Hi, I am Valder Beebe. I am the host and the visionary of That Celebrity Interview.
Hello, Dr. Simpson. This is Valder Beebe in Dallas, Texas, talking to people across America. How are you?
I'm fine, thank you. How are you?
I'm fine. I want my audience to know that Dr. David Simpson is the professor of neurology at the Icahn School of Medicine at Mount Sinai in New York City. And he's here today to talk about diabetic peripheral neuropathy, or I think it's currently we know it as diabetic nerve pain. Dr. Simpson, tell us, first of all, what is diabetic peripheral neuropathy?
Of the 34 million Americans living with diabetes, about 10 million of them have a complication known as peripheral neuropathy. That's a disorder of the nerve endings which go to the feet and the hands. And about 5 million of those patients develop severe pain. And the pain can be burning, tingling, pins and needles that can be very disabling, both physically and emotionally.
Is this a part of us seeing people lose their limbs, or is that something separate?
Well, diabetics develop other complications, including affecting the circulation, and that's called vascular disease. And that's usually the cause of amputations and related complications. But the symptoms certainly can overlap with diabetic neuropathy when there's pain in the feet.
How challenging is this to diagnose?
It is challenging. Unfortunately, patients may ignore the symptoms, and even when they bring the symptoms to the attention of their physician, the doctor may not attend to them, either because of lack of knowledge, or they have just too many other priorities and medical problems to deal with that patient.
Once it is identified, how hard is it to treat?
Treatment is not ideal. For many years, the primary treatments we've had for painful diabetic neuropathy are oral medicines, antidepressants, anti-seizure medicines, even opioids. And those medicines have side effects, and we all know the problems with opioids today with the opioid epidemic. Therefore, there is an unmet need for new breakthroughs, and there is one that's recently been FDA approved, known as Qutenza, or the high concentration capsaicin patch, which we can talk more about if you like.
I would like to talk about that because my audience is made up of baby boomers, and I'm sure a large number of them can identify with the words that you're sharing today. So let's talk about that treatment.
Sure. Well, many people can relate to capsaicin, the active substance in this medicine, because capsaicin is in the hot chili pepper. So when you put hot sauce on your food, like I know you like in Dallas, or when you bite a hot chili pepper, you get that burn. And that same chemical is put into this Qutenza patch. It's placed on the patient's feet in the physician's office for 30 minutes, and it only has very local, minimal irritation that rapidly goes away. And a 30-minute patch application can result in 3 months of pain relief. I've had the opportunity of working in partnership with Averitas Pharma in clinical research studies and have used it in many of my patients with real success.
This is just a treatment, not a cure?
That's correct. This is a treatment for the pain associated with diabetic neuropathy.
So the pain must get to be pretty awful at some point in time.
The pain can be terrible. In fact, patients will tell me they feel like they're walking on hot coals, or someone has a lit match to their feet 24 hours a day. And you can imagine how that must feel.
But we get the picture from that. We can all understand that. So when you're how do you get identified that you need this medication if our primary physicians are not diagnosing what we have? How do we get this?
Well, I always tell patients to be their own best advocates, and when they see their physician, they should insist that this problem is dealt with, and they may encourage the physician to refer them to a specialist, perhaps with a bit more knowledge and expertise, who can both make the proper diagnosis of neuropathy and then discuss with the patient the availability of new treatments, which are only now being recognized since this is such a newly available medicine.
I'd like to do a health update for my audience. I've started doing that, and it seems to have resonated extremely well for them. And the question for my health update today is, someone with diabetes, even this condition, what is the recommendation from you as a doctor? How do they stay healthy or try to get healthy?
Well, of course, they want to manage the diabetes as well as they can, and we know that diet, exercise is a key part of diabetic management. Many patients may need medication to control their blood sugars, because we know that when blood sugars are not well controlled, that can lead to many complications, including neuropathy. And then more specifically, when they have these symptoms of neuropathy, to discuss it with their physician, perhaps see a specialist, and get the best available treatments.
I have my audience listens to me on all types of platforms, and I have this one from, this is from Facebook. The poster wants to know when you have a diabetic condition, who treats this? Is it an endocrinologist, or what kind of doctor should be treating you for diabetes?
Well, since this is such a common condition, we mentioned 1 in 10 Americans, 34 million people have diabetes. Certainly, many primary care physicians will be seeing these patients and managing them. Many patients do see a specialist, like an endocrinologist or a diabetologist, a diabetes specialist. And when neuropathy is in the picture, they may need to see yet another specialist. In my case, I'm a neurologist, pain management physicians, and others with the expertise to manage these complications.
Dr. Simpson, you've given us so much information in this short amount of time. I truly, truly thank you, and I know my audience is made of baby boomers, and you know that, or people born between 1946 and 1964. And, 10 million of them are retiring every day. So this information is valuable to them, and that's what helps to make my show a success. So I just want to thank you. Is there a place online for my audience to go and get more information about anything we've spoken on?
Yes. Well, in addition to speaking with their physicians, there is a website known as qutenza.com. That's qutenza.com. And there's information for patients as well as for healthcare providers.
Dr. David Simpson, I know your parents must be so proud of you wherever they are, and thank you for being so smart and being my guest on the Valder Beebe Show.
Well, my 99-year-old dad in Florida appreciates what you just said.
Thank you so much. Be healthy, be well.
You too. Thank you, and it's a pleasure.
My phone pouch. My phone pouch is a great invention. It allows me to go hands-free, pocket-free, purse-free, even belt-free. Head on over to myphonepouch.com. Hi, I'm Valder Beebe, host of the Valder Beebe Show. I have used Credit Help USA, the credit restoration company that's bonded and state certified. When you become a client of Credit Help USA, you become eligible for a set of stainless steel cookware from Credit Help USA and the Valder Beebe Show. Get your credit straight today. Visit credithelptx.com, click on the Valder Beebe Show icon, and get started living life divinely.